Hi everyone, a very good afternoon or evening. Thank you for taking your time out with us on a Thursday afternoon. So before we jump into the panel discussion, I think I would like to spend a couple of minutes just to introduce Trendlines Labs to everyone. So my name is Yao Long and I head business development for Trendlines Labs Singapore. Trendlines Labs is a business unit under the Trendlines Group that focuses on providing new and next-gen product development services. We focus on being the innovation partner for healthcare companies. The areas which we focus on are in medical devices. They could be mechanical devices such as catheters or minimally invasive surgical equipment. We also focus on diagnostic and also health tech. In terms of health tech, they could be image processing or elderly monitoring devices. In terms of our global footprint, we have three offices, Labs Israel being our HQ, which has been around for almost 10 years. And our two newest additions are in China and Singapore. This is to go along with our expansion strategy of really meeting the demand in Asia and the Southeast Asian region, because the MedTech innovation is actually exploding in this region. How will working with us be like? While we do carry out the traditional business models of fee-for-service with our clients, we also now focus a lot on our new business model, which is an invent and invest model. This is where we focus on finding high potential ideas or concepts with small MedTech teams or even large companies. And we really become their collaboration partners. By this, what we mean is we invest in kind, or we put in sweat equity to have some skin in the game, as to say. And that's where we will move the product together with the customers, and we'll be partners with them to move it to the next growth milestone. Now, you might be thinking, how do we bring value to the table? Well, what we do is we bring the experience and the expertise in terms of the art of medical device development. What is the art of medical device development? This might be something you don't come across often. So what I have here is actually a word dump, an image of a word dump or a word app, however you want to call it. Basically, this kind of represents the day-to-day, even year-to-year sort of activities that goes on for a startup founder. For a founder, one day they may be looking at technical development, they may be thinking about the engineering aspects or IP aspects and how their patent strategy will be. The next week, they may be looking at how they fit into the market. So where do they stand in terms of the niche? How should they enter the market? What distributors they should be working with? And maybe a couple of months later on, they'll be looking at their risk management or managing the regulatory strategies and even their where they play. So this really represents the bespoke approach that Trendlines Labs can bring to the game for our customers. We look at the current status of the companies or startups we are working with, and then we come from a very custom approach to make sure that it fits in terms of where they're trying to get to and what sorts of capabilities they have on hand. Now, in terms of the project types that we could engage on, this fishbone here really shows where we can play. So you can really see we deal with development that's in the early days all the way up to the market launch. We could be dealing with projects that are just looking at an idea in the head of a surgeon or a doctor. It could be just a concept drawing, and then we can look to move it towards finding a problem solution fit. Or it could be a product that is rather mature in terms of its feasibility, and we're moving it from the bench top to get it ready for market launch. And now, so in terms of the expertise that we have in-house, in terms of technical expertise-wise, these are a few of the examples that we have on hand for projects. So like I previously kind of shared, we deal in the mechanical space, we could be dealing with GI tubes, we could be dealing with Foley catheters, and also wound management. In terms of hardware, we play around in terms of ultrasound systems, and also in terms of airway visualization. And types of customers that we work with span from, as a very large span. So we could be working with a very small MedTech team. It could be just one or two founders that are trying to get the idea off the ground. We could be looking at it in terms of being a sounding board, how their technology is going to be applied, how they could move through the various different developmental stages. And it could also be working with SMEs or large MNCs that are in the region. We can become the external innovation partners for them and really fill in the gaps which they have internally in terms of perhaps their resources, talent pool, and all those. Now, examples of MNCs or SMEs that we work with is Bayer and Bibron. So these are two German MNCs that are in the MedTech space. And in terms of early stage or smaller startups, we work with Intervaal, Continental, and we also work a lot with the healthcare institutes in Singapore, such as SGH and the National Healthcare Group, which consists of Tan Tock Seng Hospital, and we also work a lot with the institutes over in Israel, such as Rambam, which is a very famous healthcare institution over there. Now, so I was talking about engagements, the types of projects that could happen, kind of categorized into these four general classes. Now, these are very large classes. Projects that we run may fall into subsets of them, and they may overlap. For example, working with a small team of doctors, we could be looking at diagnosing some of the opportunity areas that they have, but also looking at regulatory strategies and how they could potentially manage their patents. So that will overlap over some of them. Now, if you're thinking that some of these might be too daunting as a project to start, we are very aware, as Trendlines Labs are aware of how innovation happens. We know that innovation needs to kind of happen in small little bite sizes in order to get to the small next milestone to win. So in terms of getting started, we do have programs and clinics that we hold with our customers, our clients, so that we can kind of address some of the more urgent issues that they have, which is causing them not to be able to move forward. So we do offer such short sessions and also for quick wins for the companies. So if this interests you, we actually are going to be offering this short advisory claims through the Catalyst platform. That's where we will be working with them to kind of offer it to the community of Catalyst, members of Catalyst. So if you're interested in that, do keep an eye out on social media for Catalyst and also their website. And also you can feel free to reach out to me at my contact details over here. That's the end of my introduction. Without any further ado, let's jump into our panel discussion. Okay, for those that may have just joined us, my name is Yao Dong. I will be the moderator for the panel discussion today. Today, we've got an amazing panel on startup formation and also growth, where we will be talking about navigating the journey of running a medical technology startup. For many founders, or potentially even would-be startup founders that could be in the audience today, this is an important topic as Singapore and the region gears up to the next level of medical tech startups. We are seeing experienced talents with previous startup backgrounds come out to work on their second or third company. And also with the demand shock that came out of the 2020 COVID pandemic, many companies are actually thinking about, they're looking to transition with the help of innovation, both internally or externally, to become their own brand or product owners. So now I'd like to take the chance now to introduce the panel. So I have Nir G, who's the CEO of Trendlines Labs.
Hello, everyone. Nice meeting you.
So he has over 20 years of experience in the business development field, especially in the medical innovation industry. I'm sure it'll be an interesting conversation. And then I have Kobby Greenberg, who's the Director for Project Management from Trendlines Labs.
Hi, everybody.
He brings with him more than 15 years of experience in the medical device industry and has held several senior technical positions in medical device companies, including his own startup in the laparoscopic closure space. Okay, and then last but not least, I have Simon, who's the project manager from Intervaal, which is a startup that is developing a line of novel Foley catheters with the enhanced capability to prevent catheter-associated UTIs, urinary tract infections.
Hi, pleasure to be here.
Yeah, Simon's an engineer, consultant, and also an entrepreneur. He's worked in the US and China, and then now in Singapore. He's worked for both large corporations in healthcare and also in startups that dealt in 3D printing and the logistics industries. Yeah. So to kick things off, let's start off with a very fundamental question that's to do with our topic today. This is something that people may not ask very often, but it could be important in terms of guiding the decisions in a company. So the question is exactly what is growth? So what is growth to a MedTech startup in the formative years, right at the beginning? What should growth kind of look like? Maybe let's kick this question off with Nir.
So thank you, Yao-Lung. Thanks. So I think, of course, growth is you can associate this term with different aspects. But when you look on a startup journey, you should look on a few pillars, which are the crucial pillars for the startup. Key pillar is the technological pillar, in which the startup must generate growth. In parallel to that, the regulatory pillar, which is crucial to advance the progress of the startup itself. In parallel, there are additional pillars, and we will not mention all of them, but one pillar which would needed to be mentioned here is the commercial pillar. So when we are talking about growth, we cannot leave aside the commercial aspect, and this is something which is very important. Although many startups are struggling and focusing on making significant steps around the technological pillar and the regulatory pillar, we should always remember that the commercial is the bread and butter, the oxygen of the startup. So a key focus should always be around how do we make progress and reach significant inflection points around the commercial aspect. So how do we generate value to the company itself, to our potential partners, to our potential investors? This is a crucial point. So these are the three key pillars that I would mention for this aspect.
Okay. Thank you, Nir. Now, Kobby, what are your thoughts on this?
Yes, I completely agree with Nir. Just would like to add that in order to maintain growth or even to reach growth, which is associated with the commercial phase of the startup, is to find ways to fund the startup. So money or funding is a crucial pillar for getting to the commercial phase or to the growth in any aspect. For the early stage, for research and development through proof of concept, and then of course for preclinical trials, clinical trials, and regulatory submission. But mainly for the growth, because in order to do this jump from prototyping into mass production and sales, the startup has to get or to fund a lot of money, a lot of funds from investors. So in my aspect and from my experience, this task should be started from almost from day one of the startup. Look ahead and see how you get the funds in order to get there eventually.
Okay. All right. Thanks, Kobby. That's a very interesting point. Now, to go on to the next part of the question, this one will be to Simon. So since you're so kind of deeply entrenched in a startup right now, you're kind of running one now. How does that more kind of high level aspects of growth, how does that break down for you on more of a day to day, and what do you try to get done week by week to get your growth?
Well, I mean, as Nir and Kobby mentioned, so it's you need to plan very far ahead for it, and it's not as simple as it's of course it's not as simple as making a interesting product. You know, I think a lot of people who come into particularly medical device space, they come with a new idea and they say, oh, this is new, like this will probably sell, because they often come into it with the mindset that's benchmarked off of, say, normal retail markets. But they must realize, as Nir properly pointed out, that commercialization is really critical, and commercialization in medical devices is drastically different from anything you see in retail. The number of different stakeholders in any purchasing decision is so much more than just a person with money. You have doctors and nurses and purchasing managers and equipment managers and hospital administrators all involved. And surprise, surprise, they all have different interests. And this is something that most people, particularly people who come from, say, lay people, or even people coming in from a pure science background, they tend to realize this a little bit too late. And so they'll develop their product very far and all of a sudden see like, oh, this is interesting, but no one wants to buy this as I've made it. So what it boils down to in the day-to-day is reminding yourself constantly, well, arming yourself with that information by researching as much as you can, speaking with all these different stakeholders, understanding what their unique perspective is going to be on your device and your value proposition, and then modifying your value proposition as early as possible to align with as many of those stakeholders as you can. So that's what that's what my particular role is as a non-technical role. So it's like a balance to the technical aspect. The technical just wants to make something new and interesting, and I make sure that it's something that the market wants and that can thus eventually generate revenue.
Okay, thanks, Simon. Now, that's an interesting point. Making what someone wants, what people want, what the market wants. So that's interesting because if we were to look for any startup books or educational materials, they will always talk about the MVP. They will always talk about building fast, launching fast, and also failing fast. But I mean, maybe those are more applicable for perhaps software as a service. Not so much for a regulated environment, might work very well for consumer tech. So how does that transition for a MedTech startup trying to find out that whether the market really wants their product? So what are some of the essential tools, perhaps tricks that they can engage with in this kind of formative years to figure out, okay, am I building the right thing over here? I'm leaving this as an open question, perhaps. Is there anyone to take this first?
I'll have a quick go, and I mean it's like a follow-up to my previous answer. And well, my strategy, which is strongly driven from my consulting background, is I just do research. You research unendingly. You basically never stop. Well, first, of course, you try and hit all the stakeholders as early as you can through whatever networks you have available. Talk to them, or at least get their opinions indirectly through some literature that may be available. There's a surprising amount of literature available, particularly in medical device and healthcare spaces. So that's a good place to look if you don't have these people in your network. But yeah, it's research, and you never stop doing research, because sometimes, I mean, not so much for my market, fully catheters, but for some newer devices, the tastes and preferences of the market can change over time. And considering the long development cycle, that means it can change during your product development period. So what you come into the project thinking you need and what the market wants at the end could still be different.
If I may add, I think from my experience as well, you need to learn, as Simon said, to research and learn what the market needs and how the market behaves, and it is different between each territories. For example, in the US is a little bit different from Asia or in Europe or other territories, and in each territory, for example, in Europe, East Europe, and West Europe, also act differently. So, for example, in the US, they have a nice tool that you can usually, when you try to sell your product to the hospitals, you are dealing with bids. And the big companies, the big player like Medtronic, Johnson & Johnson, BD, etc., they have the whole line of products, and they can offer a very attractive bid to the hospital. They have good connections with the purchase manager or with the hospital manager or the hospital chain. Usually it's a hospital chains there. So it is very difficult to enter to those bids and with a good offer. But for some of the hospital, they have 10% of the purchasing they have to purchase from new companies without bids. So my recommendations for startup that they have already launched their product in some territory like the US, for example, try to enter the hospital through this tool, through this new technology, no bid entry. This is one. Secondly, usually small startups are using distributors, local distributors. So this is a very good tool to enter the market. The distributor usually represents a lot of small players, and together they have a big force to enter the hospital. They know the people that are the stakeholders there in the hospital, and resources that you need to invest is relatively small, rather to have a direct sales force in those territories.
I'd like to add just to the things that Simon and Kobby shared. So Simon and Kobby referred to two different maturity levels of a startup. Simon was more emphasizing his answer around an early stage company startup, and Kobby was giving some suggestions for a later stage startup or company. I want to touch on what Simon said regarding the research. I think that's a very good advice. I would like to emphasize one point beyond the research for an early stage startup. A key aspect to never leave or to always push forward is the voice of customer. I mean, besides defining your product positioning and understanding who is your customer and defining that really carefully, who is a customer, who is your stakeholder, the voice of customer is really important. And so some things which you typically see is a gap between the snapshot that you can receive from research, which is mainly based on literature, and what is really happening in reality. And that gap could be mitigated and minimized via the voice of customer. One more point is that the way I see it is that the voice of customer is not a one-time event for a startup. I would suggest to see this as an ongoing process. So speak with your customers and speak with them frequently and in an ongoing manner, because the picture changes and thing changes and your understanding of the market changes. And one more point, which is important around voice of customer, which Kobby touched upon, is to really understand the differences between target markets. So after you understand who is your customer and you listen to him, try to get a broad feedback. So talk with many customers, many stakeholders, many physicians from different territories, and get different perspectives. More you do that, more you listen, better you can fine-tune and address your product, your system, your device to the real core market needs, while providing to the end customer the high or the more promising value proposition. So that would be my key point for this question.
Yes. If I may add shortly, another strategy for mature small companies is alliances, meaning going together, two different companies going together to offer the hospital a complete product lines. Some, for example, surgery tools and other radiology tools, so they can offer like a big company a complete line of products, but they are combined from several small companies. So this is another strategy that is usually used in order to enter the hospital, especially in the US.
Okay, thank you. This is very interesting. I mean, that's kind of bundling it up so that distributors will find it a lot more attractive to take it on. And I think the point of using distributors as a form of surveying the market is really quite an interesting point. Can be comparable to consumer tech just launching and then finding out how many people are willing to put in their emails to buy this, because obviously you can't do that in the MedTech startup that way. Right. Now, to move on to another important topic of today is, now we've talked about the customer voice, and then that definitely ties into building empathy towards the market, and it's a consistent cycle. Now, I think this might be a question on a lot of people's head, is when will it be a good point at which to say that, okay, I know now that what I'm trying to build has actually people that wants it, and then it's a good time to now form a proper company, go around looking for founders team to join this. Or some people just come more from the point of, okay, I've got a solution now, I want to find a team of form a startup in order to move this towards the market. Like in your heads, when is a good time to have that happen, forming a proper startup? I'm talking about maybe registering it and then like literally trying to get funding to come in for it. Maybe this question I could start off with Simon.
Sure. It's a tough one because I think we would need to break down, because it's, you know, usually two ways people walk into that situation. One is they come from the market problem side. So they see the market problem and say, like, this really needs to be fixed. If people come from that and they don't really have a solution, or they have a vague idea of the solution, I think for that case, that's a more than good enough time to get going, because the sooner you start, the sooner you can finish. And, you know, assuming that this is an idea someone else may stumble upon, the sooner you start, the better from a competition standpoint. The other way people may come at it is from having a technology and, well, like looking for a nail to hit with a hammer. For them, I would say, I think, yeah, they would need to have at least a pretty good idea of one, maybe two needs where that would fit. Because I mean, ultimately, that's the important part. You need to know that there's a problem out there to fix that people will be willing to spend money on. Because otherwise, then, you know, starting with just technology and starting a company and hiring people, that's just starting way too blind. Because no matter how cool the technology is, if no one wants it, You can't build a company to survive without revenue.
What do you think, Kobby?
I completely agree with Simon. This is the fundamentals of forming a MedTech company. I myself formed at least one MedTech startup, but we need to consider other parameters before we form a startup. First of all, obviously, we are looking for unmet need, and we need to research for unmet needs. whether, like Simon said, it comes from the technology down to the unmet need, or for the unmet need up to the solution. But we need to have both unmet need, very defined one, and a good solution. What I would add is a patent. I think patent is important. It's not all, but it's important at least to have a patent search, not by yourself, by somebody which is a professional, that you can do it by yourself. Google Patents is a great tool to start with. After you find that today, I think it's the patent arena is quite crowded, and it is difficult to refine what is what are you going to infringe or not, and then to take a patent attorney or other entity to help you to search for patents. I think this is basic. Then the fourth one is how you are going, what I said earlier, how you are going to fund this activity and where. So my suggestion today, Singapore and Israel, you can get good investment from the government in Israel through the chief scientific,
The Israeli
you can get the Israeli Innovation Authority, sorry, thank you, Nir. You can get up to $1 million today for 2 years. So it's without dilution. So it's a very good investment. The government, I believe you can get a very attractive grant also in Singapore and other places. And the fifth one is the regulatory strategy. I think this is a very important one for each and every MedTech company, because at least in the US, but it's all over the world, there are different paths for the regulatory. Whether you can get it almost for nothing, whether you need to spend $1 million, or whether you spend like 15K, or whether you spend 10 or 20 or $30 million. So it gives you a forecast where are you need to go and how you are going to get there. So this is my insight.
Okay, that's an interesting point. So now that you brought up the point about IP strategy and searching for patents, I think that's something that might be on people's minds in terms of obviously it takes time and resources to be able to go about searching through the IP environment and then figuring out, okay, do I have a niche that I can play in, and then subsequently filing. So how do we balance that act of protecting the IP and then going out to talk to people to figure out the voice of the customer? Is this something that what I'm building going to make sense for you? Obviously, I can't share with everyone if I'm thinking very focused on IP, right? Protection.
Yeah.
So how do you think we can balance that aspect of it? Going back to Kobby on this one.
Yeah, how to talk to people without revealing my invention. That's what you meant.
Yes, and balancing the speed of me wanting to grow and launch the product. That means sharing with manufacturers and developing design houses. How to balance that?
Yes, my recommendation is not to share too much information with stakeholders that are not important for this stage of forming the company. Usually the stakeholders that are, or the people or the entities that are important for forming the company at early stage is the clinician, or someone from the technology side. So you can interview some of the, if you have a good connection with a clinician and he's trying to convince you that this is the best idea ever, I would suggest this guy to go to another one and maybe ask another clinician what his opinion about it. Maybe to sign an NDA, which is a great tool for sharing information without having a patent filed already. So using an NDA, we're using it every day. And then do a survey, a literature survey, and a call of customer with not 100 or people, but few that you are relying on. And then most of the investors, government investor, would conduct the due diligence on your invention, and you will get the feedback from there as well. So
okay, all right.
Stay humble, and interview or get information from the surrounding that you are rely on, and use NDA if it is somebody that you are not rely on or you're not familiar with.
Makes sense.
Non-disclosure agreement. Okay, for NDA.
Okay, thank you. Now, Nir, this question on to you, maybe with a little bit of a twist. Since in Trendlines Labs, you work a lot with both MNCs and also with startups. So what do you think? What's your view on this? Like, do they manage it differently? This aspect of IP against speed to market. Do they do it differently? Is there some tactics that maybe someone does better, one of the parties do better?
It's a good question. First, I would like just to comment regarding the previous couple of points that were raised. I think that you ask what is the right time to kick off your own company. I think that we touched upon that. The bottleneck for creating your own company is at the end the funding. So you need to be sure you can actually support, that you have the funds to support your new startup. And typically to reach that point, you need to go through a due diligence process to make sure that you have a good opportunity underhand. And for due diligence in our industry, there are several kind of standard aspects that are being reviewed. The forum here, the panel here mentioned these aspects. These are the regulatory perspective, the unmet needs, the solution, the market size, the commercial viability of your invention and IP position, and there are additional more tactical aspects. But at the end, if you can speak in this phase, if you can speak with people that can help you to go through all these standard or well-known aspects and go through them in your due diligence process and lead them and check yourself, that would be a good direction to do. If not, you can of course work and discuss with partners. There are several companies in different markets in Singapore and Israel that can help you with conducting your due diligence under an NDA, as mentioned, and see that you are on the right path. Of course, you know, we are here, and this is part of what Trendlines Labs is doing in an ongoing basis. So this is a key to see that your due diligence is leading you to be convinced and confident that you have a good invention under your hand and a good venture under your hand. Then beyond that, typically the milestone or the inflection point that would allow you to start and generate funds for your invention, it doesn't really matter right now if you're talking about funding coming from from early stage investors or from angels or even from grants. Typically, you need to see that you can bring yourself pretty quickly to a POC, to a proof of concept around your invention, which typically would be an early stage POC, which could be kind of a lab POC. Sometimes in our industry, a preclinical POC would be great. But once you can present a proof of concept for the essence of your invention, that would be the inflection point that would support your ability to raise funds for your new company and your ability to kick off a new company. So these are the key points here. Regarding IP, IP is crucial for any entity, whether it's a small startup or it's an MNC. At the end, we have to remember that the IP is a core asset of the entity, of the company. Remember, these are your assets, whether you're a small or big company. You have to treat and maintain these assets properly. For startups, IP is even more significant due to the fact that this is a core asset of a small company which want to leverage these assets, whether it's by further investments, whether it's by a future exit acquisition. So I would really recommend, as Kobby mentioned, to put a lot of focus on your IP aspect. See how you can first bring to the table significant novelty, and B, protect your IP, protect your assets. This would be my 2 points. How to do that? You can do it by your own, as Kobby mentioned, some initial exploration of the IP scenario or a arena could be done alone via some existing tools. You can do it with some consultancy companies which can do for you IP searches, and you can also do it with IP attorneys. When you start working with consultants or attorneys, you will have, of course, fees. So you have to remember that. But still, I would recommend investing quite a lot of efforts and resources on making sure this aspect is secured and brings real value to the table.
Okay, thanks for that, Nir. It's a very interesting point. So I think the questions we've been talking about so far really relates a lot to the activities that are going on in a startup throughout its early years. Let's shift a little bit to talk more about the mindset of the founder or the founding team. Because ultimately the mindset kind of controls the direction in which the founders chooses to do, make their decisions, like what do they want to prioritize on? Is it going to be focused on IP, regulatory, making sure the technology works, going out there and getting the network and people to be interested in the products? Maybe I want to touch a little bit more. This question is to Nir, because you've worked a lot with different founders and seen the differences of founders and more senior members, research members in the MNCs. What are the differences in the mentality when they have a fresh idea and then they want to get it off the starting block?
So pushing forward a fresh idea is always a challenge. Typically, the key difference between the ability of a small company like a startup and an MNC to push a new idea forward would be the speed. And you see that quite often. You see that in many cases in our industry, you see the big companies which are dominating the markets with their products. Sometimes having some challenges with the ability to bring new inventions quickly to the product, while you see small startups or SMEs being more agile, pushing new ideas into the market, and of course starting to get a grip of the market share. And I think that's a key, mainly in our world today, when of course you cannot compromise quality. We talked about doing due diligence, understanding that you have the right venture under your hand, and so on and so forth. So you cannot compromise quality and a true value proposition that would be provided to the end customer. But if you're able to do it with a good level of speed and move quickly along the milestones and reach to the market quickly, that's a winning aspect. And I think that's one of the strength points of small companies, startups. We see it very clearly in different ecosystems. For example, in Israel, this is a very strong point in our ecosystem. You see a lot of inventions, a lot of small companies pushing and bringing new solutions to the market, and it has its upsides, of course.
Okay. But what do you think of this, Simon? I mean, obviously you've been in consulting, and you've also definitely worked with the larger companies. Now that you are in a startup, now that you are in it as well, what do you think? Is there a difference now in the way you approach things and how you used to advise people to do it versus now that you are in it?
It's It's a little hard to compare all three of these. They're each very, very different. So my time in corporate, particularly say for the medical device company, the very large medical device company I used to work for. I mean, things for a large company, like things at that time were very dynamic, but it's still relatively slow moving. Decisions were, yeah, you need to present good, complete, thoroughly thought out cases to your bosses in order to move decisions. And so that process takes a very long time. In consulting, in terms of driving things forward, can actually be similar to what it's like in startup. Is that it's you prove, and then because of the short time frame, then if it's enough, if it's convinced, you can make decisions or move decisions a little more quickly because the burden of proof required is a little lower. So basically in corporate, you really need to cover absolutely everything because it's like everyone would be worried about the little thing that might just topple everything, and that will threaten the security of their planning. Whereas in consulting, the security is never there, and in startup, and same thing in startup, the security is never there in the first place. So it's I think overall the burden, the work required, the burden of proof, and thus the time required to influence decisions is much less and shorter.
Okay, thanks, Simon. All right, so we're almost out of time over here. I'll just do one last question to kind of wrap up around the panel. So what would be one piece of practical advice? So kind of like your gift, your takeaway today for the people in the audience today, that they will give to someone or a would-be founder that's trying to navigate through this whole life cycle of starting a startup, getting it to grow to a stage where they can scale. What would be one piece that you give? Maybe I can start off with Kobby on this.
Yes, thank you. So my tip for this one that is going through all those steps of establishing startup to hopefully to even up to exit, you need to have a deep breath each and every time because it's like a roller coaster. A startup, a MedTech, every startup and a MedTech startup particularly, it's like a roller coaster because you're almost there and then the money finish and you need to get money and then you need to recruit people and then you need to have a clinical trial and you don't get the regulatory clearance on time, etc., and everything is combined in each other. So you need to be very calm to take things easy. But if you are onto it from day one, and you are onto it from day one because you are entrepreneur, eventually you will get there.
Okay, sounds like you have to have a strong heart to be able to take it all.
Yeah.
Okay, how about you, Nir? What do you think? What's one piece of practical advice?
I would say build a strong team around you. I think it's related to Kobby's point. Kobby is actually, his key message is be patient and be stubborn and stick to your way. This is Kobby's note, but I'm associating my point to his. If you build a strong team around you, you will be able to go through this journey. This journey, I agree with Kobby, it's quite a roller coaster and things will go wrong and things will change. And you will need to have the level of patience and flexibility in order to go through these challenges. And if you have built around you a strong team with the same values, you will be able to go through this journey. So one point is build yourself a strong team around you.
Yeah. If I may add, I would add I refer to the character of the leader, okay? But practically and technically, I think very important way or tip is to have a very detailed plan from where you are going to the target. Very detailed plan that covers all aspects, and it has to be a flexible plan. It is changes along the journey, but it has to be very detailed and a proved one. So you know what is your next step and the second step and the third step and how you're going to tackle it, timeline and budget and resources.
Very sound advice. What about you, Simon?
Kobby had mentioned a good one about managing the stress. Meditation is fantastic for that, and I highly recommend it. Besides that, I was going to say something along the lines, kind of touches on what Nir mentioned. It's the simple advice would be just to seek help, even if you don't think you need it. So that leads to building a good team around you. A good team being not carbon copies of yourself, but people with different ways of thinking about the problems, different experience background. Because doing a medical device startup, you need to plan very, very far in advance, as Kobby mentioned. But to do that well, there's no one person out there who can do that all by himself. I haven't met that person, because it requires super depth in many, many different disciplines. It's not possible, but as a single person, you need help. So I recommend, especially for people who have strong egos, keep that ego in check, seek help, and this is a way you're going to constantly improve your plan and adapt to the inevitable market changes that we've been alluding to all this time.
Okay, thank you. Oh, so I just noticed someone in the audience actually asked, as a founder, right? How would you recommend keeping the motivation up when the progress in the startup isn't obvious? It's not like going where you want it to be, as how the plan is like. Any takers?
I would say
coffee.
I would say involve. I would say involve. So when motivation is down, if you're able to involve the people around you, if it's your own motivation, you need to pick yourself up. If it's the company's motivation, you need to involve your team and think together how to get out of this point and move forward. And when you are involving your team and people are engaged around finding a solution, typically things start to change, and you also get better vibes in your company. So I would suggest that.
Yeah, completely agree with you, Nir. Completely agree.
Okay. So I think we've come to the end of at least the discussion. I'd like to see whether I can take at least one question from the audience. I'm just taking a look at it right now. Okay, so someone actually asked Jaspreet, is there any resource that could be tapped on that you could recommend to help him or her to brainstorm and troubleshoot their medical innovation? Any resources? So the question is there any resource they can tap on to help them brainstorm or troubleshoot medical innovation?
Sorry, go ahead, Kobby.
Sorry. It depends. You can also always consult an engineering firm. I would suggest a boutique engineering firm with one that has a lot of experience, and you can do a brainstorming, usually for free. At least in Israel, they wouldn't charge you for 1 or 2 sessions, because they want the work to be done at their side, their house. This is one option I see. Also to approach entities like labs, Trendlines. We can discuss it all together and see if it's feasible. We can do it as well. Or friends and families. It always helps. In every family there is a doctor, and you can consult. Or the doctor knows a family member knows a doctor, and by a connection, you can get into someone that you can consult with.
Right. So basically, find someone that you can sound off as a sounding board, right? Talk to people.
Yeah. Yeah, talk to people.
Okay. Simon, you had something you wanted to jump in on just now?
That was pretty much it. Just talk to people. Though I think Kobby's answer is even better because what helps you, it helps the person walk the tightrope around IP. Because typically when you engage those firms, you can do an NDA up front and then you're reasonably well protected.
Makes sense. Okay. So I think we've run out of time today. We've come to the end of the panel. And I think I just want to say a big thank you to Nir, Kobby, Simon for having such an engaging conversation. And I definitely want to also thank Asra and also Catalyst for helping us to organize this short panel, and also everyone in the audience. I want to pass the time back now to Asra.
Thank you so much for joining in, everyone, all the attendees, and a special thanks to all the panelists on behalf of Catalyst. The recording of this webinar will be available on Catalyst's YouTube channel, and we will also send a follow-up email with some key takeaways like coffee, I got that one, and all our contact details if you like to keep connected. So do keep a lookout for that. And with that, have a great day or evening wherever you are at.
So just to add on, is if there's anyone who's still interested to speak more at Trendlines Labs Singapore, we actually have clinics that we are holding with Catalyst on a monthly basis. So if there's interest, feel free to sign up for them through the Catalyst portal. That's all I want to say. Thank you.
Thank you so much.
Thank you.
Thank you. Thank you. Bye-bye.
Thank you.
Bye-bye.